Well, greetings, everybody. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk this morning about temporomandibular joint pain, and I'm going to show several people, several women really, since this one's going to be associated with a woman with a long-acting TMJ pain, and what happens to all of them have some different reason for making it start, but the pain was in the jaw joint itself, and I'm going to try to explain that, what the pain is here, and hopefully this will answer the question for this lady. Yesterday, a lady from California, or day before yesterday, called, and she's been hurting for 20 years or more, she said, and she's tried everything under the sun, and I told her, well, I'd worked on people's jaw joints for years, and we got the pain stopped for everybody, and that's unusual. But the clicking of having the disc off, I could not stop that. But that can be stopped, but you have to have surgery of the joint, and they have to go in, and if the disc is still alive and good, they can pull it back up and suture it in place. But that's a big deal on the other side of it, or you can just leave it alone and it'll come in too, and I'm going to try to explain that the pain stops when that happens. So let's get going here, and I want to show you some things about the joint. I think we've had this before. You need to understand, now the jaw is out here. The teeth are over on this side, right over here. Now this is a steel joint, and this place in the University of Sweden where they actually operated on cadavers or people that passed away, and they got in there quicker and uncovered this. And this will show the head of the condyle. This is the fossa now, we call it the fossa, comes around like that. And this is the disc that's in between. It's thicker on the outer edge of the disc. And this is the retrodiscal tissue that's squished up here, but this is where the blood vessels, this is a highly blood supply area, and this is where the synovial fluid is made that lubricates this joint, and it's also where the food structure comes in here, and there's an upper place and a lower place behind on this disc, and this liquid feeds this disc part right in here. This part takes tremendous pressure, and no blood vessels. I'm going to erase that now just a little bit, and no blood vessels can live in this portion right here, and there's no nerve endings at all, and it can die and get in trouble, and you won't even feel it right there, but this will disintegrate if you push this together, and it holds here, and he cuts this off where the food material can't come underneath here and get pushed into this tissue and feeds it and takes it alive. And this is marvelously made. I'll be 96 here in a couple of months, and my jaw joint is still working. And this guy, it's kind of like the condyle is shaped some kind of, not just a round, kind of like this. And this thick part around here has a blood supply, but the blood supply, this is great, and around here is good, and that is where the synovial fluid with the oxygen and the food for the disc part in here secretes this in here, and as you close lightly and everything, it pushes it into the tissue, and this tissue lives. But if you push this together, and this together with a broken jaw, and you keep this where you can't get fluid in there, this tissue will actually die, and you won't even know about it. And this is extremely tough tissue, which doesn't wear out in a whole lifetime if you take care of it properly, is about like cheese. You starve it to death and it can die and you won't even feel it because there's no nerve endings in there. This is what you need to know about this. Now I'm going to erase that and we'll go and we'll show several pictures of the jaw joint. And this, I think, both of them, this is going to be the condyle, and this is the fossa up here, and this tissue is pushed up in this joint. Let me go through these. This is back when the teeth are pretty much together. And two, now we're going to move the condyle down, and it's coming forward like you're going to bite something. You kind of open your mouth a little bit. And this is the disc, this right in here, and it's like a biconcave deal. I mean, it's got a thick side and a thin and thick, and it comes in kind of like this, like that. And but it's not just a round thing. It fits over the condyle, and the condyle itself is not just a round ball. It is marvelously made. Like if you want to chew on the left side of your mouth over here, you just move over here, the condyle stays in the fossa, or this one over here comes out of the fossa, moves from here over to here. And that separates the teeth over on the right side of the mouth, and you can chew on your left teeth over here, and they come together, but nothing else hits. The anterior and the posterior is supposed to hit at all when you're chewing on the left. Now I can turn and chew on the right side over here, and then the right condyle stays in place, and the left one comes down onto the eminence over here, which moves it about this much clearance, and that separates the teeth over on the left side of the mouth and the front teeth, and you can chew like that. Now, when you've got a deep bite, there's so much to cover here that it's going to take a little longer than I want it to, but you need to know that. If you have a deep bite with your upper teeth closing over your lower teeth like this, and you go to move to the side, you can't do it. That is a bad situation. You can just chew straight up and down. You can't do back and forth like that. So this is, people that do research on this say that it's 4 times more efficient to grind your food than it is to just chop like that over there. That's the way a dog does, and they swallow that, but they have tremendous acid in their stomach, and it dissolves darn near anything. In fact, the acid in our stomach will actually eat the teeth away if they have a bad valve down here, and you belch this acid up. And I have patients that came in, and the lingual side of their bottom teeth would just be eaten away. And the tooth, instead of being shaped like this on the bottom, there would be something like this. And this whole portion would be eaten away by the stomach acid coming up in here, and you'd have to come back and get this valve fixed down on the bottom back here, put some pins in there, and you put some around and develop the back side of the tooth and redo it for people like that. But that's not what we want to spend too much time on here. Now I want to go on to another picture where we're going number 3, the condyle. Whoops, let me see, I've got to go back here. All right, number 3, the condyle now is right underneath the fossa. In other words, somebody is moving their jaw to the front, or they're chewing, and when you're chewing out here, your front teeth don't come together, but the teeth in here hit and chew and work without that, if they have a correct amount of overjet and overbite, then they could come out and chew right here, and that's where we do our chewing from side to side like that. And this thing moves one way or the other, and it separates the other teeth. Now, when I bite something on the front teeth out here, if I pull this thing out, and it'll be biting in this area right here, and then the front teeth will be coming together. Let me erase this, and you've got your upper front teeth like this, and the bottom teeth are hitting right in like that. You're chewing out here on these teeth, and there's quite a distance between the front teeth here and where the muscles are pulling up on the jaw joint and pulling it back and forth. And this is one muscle that most people use maybe to excess sometimes. It's the same thing as your elbow. I don't know whether you can see my elbow. Well, I can't get it up there far enough. But when I pull my arm up and down here, the ligament in front of the joint of the elbow is about 4 inches out here. And I move this about an inch here. This will go 5 or 6 inches in the front part of the jaw. And that's the same way, but the elbow is not near as complicated as this joint here. So our muscle force is in this area, and where we chew is quite a ways out here. So you have to put a lot more force back here, and the rotation point is back in this area, and that's where it's the way we chew. Now let's get on through this. Now if I go to number 4, the condyle is coming over like this, and it's coming out here. This is the fossa now, like that. Now, every one of these women that we've got and shown has a problem with this. If you get hit in the jaw and you don't have a mouth guard on, holding it and protecting it from moving back in here, and it'll go back and crush that area. Now, the condyle is going up here. If you get a blow in the jaw and it shoves this condyle back in here, it will damage this retrodiscal tissue and also part of the tissue around the disc. In other words, your biconcave thing like this. In other words, it'll damage that, and that swells up, and now every time you chew, you mash into that, and that's where this long-term pain comes from, and that's where people try to get something done. They think it's their head, their neck, their shoulders, and all this hurts. If you just continuously irritating this tissue back here and you not let it grow. So you have to put yourself in a splint, and when we put you in a splint, we would pull the jaw forward, keep the pressure off of this retrodiscal tissue, and now as long as you had the splint, and you'd have to have a ramp on the splint, which I'm going to show you on this lady when we get through here. Now number 3, that's out on there. There's number 4, and here's number 5. The condyle gets out in front of this eminence here. Now some people will yawn or open their mouth real wide, too wide, and the condyle may get up like this on the side, and the eminence is down here, and now they can't get it back behind here, and their mouth is open and it's hurting like the dickens. If that happens to you, you have to pull down on the teeth back here with your hand, put it down, and then slide it back and get the condyle back on this side of the fossa, so it functions like that. Now this is 7. It's out front. Now you see the thickness of this disc. It's a double concave disc, and this portion right in here is a portion that there's no blood vessels or no nerve endings in this piece of tissue right here. But you do have some in this and this out here, and the retrodiscal tissue that you're going to push into, and that supplies this fluid in the upper and the lower joint space, and it's pushed into this portion. This takes all this tissue, that feeds it, and that if taken care of properly, that can last 100 years, I guess. It is very tough material there. So then I'm going to go on to the other deal. Now that's number 8. It's going back up again. And number 9, the condyle. There's a space up in here. This retrodiscal tissue is going to be in here. And we've got this has the supply, and this supply, and the blood supply in here makes this synovial fluid, which is pushed into, this is squeezed into this area of the jaw joint right there. Now here's number 10. This condyle is pushing against this tissue, and liquid will squeeze in between above and below and feed this tissue right in this area and take care of it and lubricate it. And this synovial fluid is some of the slickest stuff mankind can't make it one that's that slick and smooth. All right, let's see if we have number 10. I think that's the end of that. So I'm going to go over here and show you some things that happen to the jaw joint. Like the joint can be hit certain ways, and it'll push. If you just hit in the jaw real hard right here, the condyle will go back in here so hard that it'll squirt the disc out in front of the deal, and then your disc will be out. Here it is. The disc now is out here in front of this. Now the condyle's back here. There's a cut through it here. When your jaw goes out here, and somebody will open their mouth, and they'll get about halfway, and they'll go click like that. This will snap back up on top, and then it'll stay on there while they go out. Then when they close again, it'll slide off again. It'll make a kind of a boop noise as it slides off. And so now you have to treat everything you have where the teeth meet back here. And if you make a crown and you make it when the condyle is on the disc, then you'll have a certain amount of space in here. But if it comes off, then that'll be hitting high, and that gives a pause to, in other words, you put a crown in the wrong place right there, and you'll have some trouble with it. And this is something people, dentists and everybody doesn't understand fully. Now this is going here. Here the disc is wadded up in front of this condyle back here. This is cut away, and it looks like it doesn't have the surface like it normally does. And this is the fossa in here where it's coming up. And this is number 5. The disc is back. It's here, and we're closing. And about halfway to, this will slip back in. You saw that disc go back in again. Now the disc is in here, it stays in while you're closing, and then when you open your mouth, it'll click back here. Now we were not able to get rid of these clicks. If you do, you have to go in and operate on the joint back here and put sutures in this, pull it back here. But there's a Dr. Wolford in Dallas that does that. He has little staples he puts in the back of the bone, back of the condyle, and it has threads in those staples. And he'll take that and suture that to this and keep that up there, not let it slide off again. Now you can do that when there's an early one. Now I'm going to run through it and we'll show where this breaks down even further. Now that's here the condyle, the disc is sliding in here and it'll pop off. All right, now if this is tied together, we used to, when we fixed a broken jaw, they tied this in here and this would sit for several weeks without any food for this, and this disc would just die. And I've talked to old surgeons, they said you could scrape over it and it's kind of like cheese. It's just gone. But you didn't feel any pain, but the thing is gone then. And so now you've got a hole in the disc. So here was the disc, and now there's a hole in here, and this is the other side of the disc. It's separated from that, and I'll pull that down and you can see it. Now there's just another position with it, and there it is there again. Now they separated, they pulled it down, and this is an opening in the disc. Now this is cut away. You got to remember they had to cut this to get in so it's not fully round. So the whole, this part of the disc is gone now. And now you still have blood supply up in here, but this is going to go for a while. And now this bone is going to be rubbing against this bone, and the condyle assumes a kind of a bird beak shape like that. And then it just slides up and down, and you can hear it scraping when somebody chews. And this, amazingly, doesn't hurt people very much. They hardly do it, but the scraping noise will bother them. See, this is gone right in here. That's gone. Now we see that's another position where they come down, and this is part of the disc here. This part's just completely pulled away. That's 10. Now here's another one. That's hard to see what's going on in here, but that's a disc is damaged really bad, and it'll slip to the side. Now if you get a chance, get hold of this video. If you look on the videos we have at the first, I've got this video made by the two university professors there, and they do with a high-speed camera, and you can see. Now this is a disc that's completely gone, and it's been that way for a while. I mean, for several years maybe, and it's just like something like that, going back and forth. And I had a patient one time that it was clicking, and I said, well, you can do this, we can maybe try to get it back up on there, but it's hard, we can't do it much. And they didn't want to do the surgery to try to suture it back in there. That's a really extensive thing to do, so they just went without it. So several years passed, and the lady came back in and says, well, this clicking stopped, and it quit hurting. But say, when I opened and closed, I felt this kind of a scraping noise up here. And I x-rayed it, and the head of the condyle, which used to be round like that, is kind of bird-beaked, and it's going back and forth like that right there, but that doesn't pain the person. There's no pain much to it. And that's where this comes in. Actually, the disc just disintegrates, and the back portion of it is here, and sometimes it come into it, and you don't even have anything up there to close on. Now, every one of these ladies that I'm going to try to show has problems with the disc and the condyle in here, but it can be caused by a lot of different things. Like you can get hit in a car or something, it'll pop your head back, it'll jerk the the condyle will go bang into this, and it'll hit so hard that it squirts the disc outside and stretches the ligament holding the disc in place, and that really hurts. And if this pushes that retrodiscal tissue in the back and damages it, and it swells up, and now every time you swallow, your condyle is going to push into that swollen tissue. It's just like having a sore place on your leg. Somebody hits you real hard there, and it's sore, it swells up, and you touch it and you push on it, and you just keep doing that day after day after day. Then the pain seems to be radiates throughout the body, and the head hurts, the neck hurts, the shoulders and everything has. And this is a similar pain pattern if your vocal cords get messed up and you keep singing or talking and damage them, then that pain will move over your body too. So I'm going to say, let's say goodbye, and I'm going to go in and show you some of these ladies, and each one of them has a TMJ problem, but it was created by something else outside, like stress and anything else. So thank you for watching, and just follow these out and go through several of these cases with me. Thank you. Now I'm going to sign off.